Chapter 25 Head-to-Toe Assessment for Nurses. Head-to-toe assessment for nurses. Performing a head-to-toe assessment is an essential skill for nursing staff. Nurses are in a unique position to assess a patient's overall health. Nurse examiners need to establish a rapport with the patient and verify her identity. They also need to assess the patient's feelings and ensure that they are comfortable. Techniques. Head-to-toe assessment is an important component of the nursing process. It is the process of looking and inspecting a patient from head to toe, focusing on each major system. The purpose of this type of examination is to identify possible problems and diagnose a patient. Head-to-toe assessment is typically performed during annual physical exams or primary care visits. Techniques for head-to-toe assessment for nurses include auscultation, inspection, palpation, and percussion. Before performing any head-to-toe assessment, a nurse must collect data on the client's appearance and health history. During this process, the nurse will look for obvious signs of distress. General survey information may include a client's height and weight, body build and posture, as well as their gait. Deep palpation, on the other hand, will reveal an individual's internal structures. This type of assessment is most useful for determining musculoskeletal and neurological problems. The nurse's head-to-toe assessment may differ from the head-to-toe assessment for a different patient population. For example, a nurse working in an ICU will likely have different patients than a nurse working in a maternal child home visit. A head-to-toe assessment requires a different technique for the patient, and it depends on the nurse's goals for patient care. A professional nurse can share stories and experiences to help students better understand the different methods of physical assessment. During a head-to-toe assessment, students may be tempted to hand out a head-to-toe skill check-off rubric. However, an active learning approach encourages students to consider the items and why they are doing them. It also helps them develop a better self-awareness. As a nurse, you need to be aware of the importance of documentation during head-to-toe assessments. While doing this type of assessment, it is critical to communicate with the patient and document the findings. You should ask the patient's consent before touching anything. Explain your intentions, and ask them how they feel before and after the assessment. After all, they're the experts of their own body, and you should take their feedback into consideration. Scope. The nurse's head-to-toe assessment is an essential part of the nursing process. It allows her to ascertain a patient's needs, current condition, and goals. The nurse then documents her findings, forming the basis for her care plan. To help her remember all the pertinent information, she should develop a head-to-toe assessment checklist. She can use this checklist to perform a head-to-toe assessment during the assessment process. The scope of a head-to-toe assessment should distinguish between abnormal and normal findings. Abnormal findings include respiratory rate changes and a drastic change in skin color. She should also note unusual asymmetry in the human body, such as different rates of strength in the upper and lower parts of the body. Abnormal findings should be noted and prioritized for further examination. The scope of head-to-toe assessment for nurses is a comprehensive one. Nurses should use head-to-toe checklists to help them ensure they don't skip steps or make mistakes during physical examinations. These checklists help medical professionals conduct error-free health assessments and help instill order into a complex procedure. Ultimately, they will ensure that each patient is receiving the best care possible. So, what's the scope of head-to-toe assessment for nurses, and how can it help a nurse make her job easier? The scope of head-to-toe assessment for nurses includes the collection of vitals. However, the assessment goes beyond physical exams and focuses on mental and emotional states as well. Once the nurse completes a head-to-toe assessment, she is better equipped to diagnose a patient's condition. This assessment allows the nurse to make better decisions about the patient's care and identify any changes more quickly. You will also be able to apply the concepts you learned during your head-to-toe assessment to patient scenarios. Benefits. The head-to-toe assessment is an important part of the nursing process. The findings from this assessment are documented and form the basis of the care plan. Using a checklist can help you remember the important aspects of this process. Here are some of the benefits of head-to-toe assessment for nurses. 1. Make it a habit to use it regularly. The thorough assessment is important for the patient's health and helps the physician to be more efficient. Accurate record keeping will increase efficiency, and the rapport between the nurse and patient will improve. Furthermore, the patient's health status can be easily assessed with the help of this tool. This assessment will also help the nurses to get to the right focused assessments. If the nurse has a thorough knowledge of the patient's current health status and goals, the patient is more likely to feel better after treatment. Aside from making learning easier, head-to-toe assessment can also close the gap between theory and practice. With a simple recording device such as a cell phone propped against a book, Students can record health assessments on a friend or classmate. Teachers can then give feedback on the videos. The process is convenient as students don't need to wait for a simulation lab opening. All they need is a willing participant. When teaching the benefits of head-to-toe assessment to students, it is a good idea to include an example of how nurses perform it in the clinical environment. This way, they can see what type of physical assessment is needed and why it is important. They can also discuss the role of psychomotor skills in head-to-toe assessment. If students have an understanding of this physical assessment, they will be better prepared to do it when they begin their career in nursing. Using head-to-toe assessment checklists prevents errors from occurring during physical examinations. Nurses no longer have to worry about mistaking or skipping steps during the process. Electronic head-to-toe assessment forms eliminate the hassle of paperwork and save time while streamlining the process for patients. A head-to-toe assessment checklist provides nurses with vital patient data for documentation and helps physicians translate this information into an effective care plan. Documentation. Nurses and other healthcare professionals use a head-to-toe assessment checklist to record the patient's condition. This top-to-bottom assessment is used to detect emergency situations and diagnose disease. Nurses often start with the head, explaining the process and involving the patient. This way, they get a comprehensive overview of the patient's condition and can use that information for a diagnosis. The patient also knows his or her body better than anyone else, so it's important to document all relevant information. Nursing assessment starts with establishing rapport with the patient. Identifying the patient's identity and establishing a personal connection is essential to ensuring the process is painless and effective. Nurses should also make sure the patient is comfortable and aware of what they're doing. By providing comfort and explanations, nurses can build trust and confidence in their work. It's important to keep in mind that the human body is bilaterally symmetrical, and if one part is missing or is disproportionate to the other, further evaluation is warranted. Having a checklist to document the physical assessment can help students remember the steps. There are many things to check off during an assessment, and a script can make it easier for students to remember. A script can be organized based on the patient's position and other factors, such as the severity of the condition. The checklist also helps students prioritize items and improve self-reflection, which can be difficult to teach. Tactile sensory functioning is an assessment of the client's ability to feel objects or identify them without visual cues. Performing this assessment may help nurses determine if the client is a good candidate for physical therapy. By assessing a client's tactile sensitivity, nurses can determine whether the client is physically able to respond to their touch. If the client feels a hot or cold object on the body, it may indicate a problem with kinesthetic perception. Limitations. Although physical assessment skills were not included in the curriculum of nursing school when older RNs entered the profession, they have been reinforced and improved upon by junior RNs. This skill may be lacking in RNs who practice in specific subspecialties. Consequently, nursing managers must focus on improving the physical assessment skills of junior RNs as well as senior RNs. This may be a challenge, especially for junior RNs who practice in subspecialties and who may not have had appropriate training. Limitations of physical assessment for nurses. The limitations of physical assessment for nurses are many. The skills taught in nursing programs are rarely practiced in the clinical setting. Nurses' inexperience with physical assessment may be related to time constraints, the lack of confidence, the need to use technology, and the reliance on clinical instructors. Despite these limitations, nurses feel that their ability to use physical assessment improves their patients' care, and that their ability to perform physical assessments contributes to the development of effective care plans. Incorrect assessments are the second leading cause of sentinel events in hospitals. These occur due to the incorrect assessment of patient conditions. An inaccurate assessment of a patient's condition may result in a death. Nurses should be vigilant frontline warriors, advocating for error prevention. Physical assessment is a vital piece of the puzzle in protecting patient safety. It takes years to perfect physical assessment skills, and nurses need to practice their skills as much as they can. A study found that half of nursing students reported limitations to physical assessment. Some of the most common limitations were lack of time, interruptions, lack of confidence, and perceived barriers to patient care. These problems may be addressed through further studies, such as establishing a supportive clinical environment and enhancing teaching quality. Further research will help identify barriers to effective physical assessment, and further studies can identify the causes of low confidence in physical assessment. Increasing reliance on technology. and portable health mobile devices could continue to limit nurses' physical assessment. Future nurses must be prepared for these changes and should develop appropriate development programs during classroom practice to minimize the reliance on technology. However, it is important that nurses develop their clinical skills in order to practice physical assessment in real-world situations. But these improvements cannot be achieved without a more systematic approach to nursing physical assessment. If nurses want to improve patient care, they must be prepared to overcome these barriers. The limitation of physical assessment for nurses may be due to a lack of experience. The study focused on students and not on staff nurses in hospitals. Further empirical studies of the impact of limited influence on physical assessment on nursing practice are needed. A systematic study of the factors influencing physical assessment in nurses is needed to determine the best practices. This study may help nurses improve their skills and confidence. For now, the study only looked at students' knowledge of physical assessment. Moreover, nurses must use several skills to carry out an assessment. Some skills come naturally and others are acquired through experience. Visual observation skills are important for determining general well-being. The use of senses, such as the sense of smell, temperature, and skin condition, is also necessary for decision-making. Observing symptoms, whether the patient is conscious or not, will be helpful in determining the optimal treatment approach. Limitations of head-to-toe assessment. If you are looking for a video on the head-to-toe assessment for nurses, you've come to the right place. This video shows you how to conduct the assessment in a realistic care setting. A nurse asks you questions about the quality of life of the patient, and then explains each step along the way. Watch the video to learn more about the different steps. Then, get started on your own head-to-toe assessment. A head-to-toe assessment is a comprehensive evaluation of the body system from head to toe. It should be conducted at the beginning of each shift and on admission. It covers all areas of the body and is important in establishing a baseline for the patient's health. If you notice any abnormal findings, you should perform a focused assessment. In addition, human bodies are symmetrical, so an abnormal finding should prompt further examination. This could signal neurological or musculoskeletal issues. A head-to-toe assessment is one of the many types of health assessments nurses perform. The goal of this type of assessment is to determine the patient's health needs, current health status, and desired state. Sakaro explains that nurses use a variety of different assessment techniques. During the head-to-toe assessment, a nurse should ask the patient questions before touching them. The patient is the expert on his or her own body, and they will likely provide the most valuable input. Another limitation of the head-to-toe assessment is that it does not include a breast examination. This exam is usually reserved for symptomatic men or older women. A nurse must determine the patient's temperature before deciding how long to perform a head-to-toe assessment. A head-to-toe assessment can take up to 2 hours. While this is not a perfect method, it is an excellent option for some types of nursing care. Another important limitation of the head-to-toe assessment for nurses is its inaccuracy. Nurses can easily make the mistake of assuming that they have assessed everything, but these mistakes can result in a sentinel event. This type of event may lead to falls, infection, or failure to rescue. With proper documentation, a nurse can prevent many of these problems from occurring. The benefits of a head-to-toe assessment are significant and well worth the effort. The research findings provide important insights about the complex issues in physical assessment for nurses and the ways in which nursing students can improve their performance. Nurses should be advocates of error prevention and frontline warriors who make physical assessments as a routine part of the job. The results of this study will help nurses and doctors improve their collaboration and patient outcomes. This is an important piece of the puzzle for nurses, and the study findings can guide the development of more effective teaching methods. Limitations of mental status assessment. A nurse's knowledge of mental health will be enhanced by completing mental status assessment. This process includes the assessment of the patient's primary language, physical and mental functionality, as well as their social and emotional well-being. Nurses can obtain this information through observation, a systematic approach, and questioning skills. RNs must be sensitive to patient cues and respect patient confidentiality. Mental status assessment requires knowledge of the principles of asepsis, safety, and privacy. During the study, the Palestinian health workforce faced a complex environment that posed multiple challenges. They faced challenges in addressing the demands of the local mental health system and cultural contexts, and the challenges associated with unrest and the lack of resources. These challenges, together with the chronic difficulties faced by health professionals, must be considered in the larger context of the collective suffering of the Palestinian population. This study also identified the need to improve mental health services in Palestine.